Good morning and welcome to the Hawaii State Senate Committee on Commerce and Consumer Protection. We're here for our Wednesday, February 22nd, 9:30 a.m. regular hearing to consider two bills, followed by a 9:35 a.m. Decision-making agenda.
Recording in progress. Okay.
The first measure is SB 438 relating to professional and vocational licensing. This measure reduces the period for which an application shall be considered abandoned from 2 years to 1 year and specifies a number of conditions accordingly. First up, we have the DCCA in support. Good morning,
Chair. Sorry.
We got you. Go ahead.
Okay, thank you. Good morning, Chair, Vice Chair, members of the committee. My name is Alani Kiyoki, and I'm the Licensing Administrator for the Department of Commerce and Consumer Affairs Professional and Vocational Licensing Division. The division would like to stand on its written testimony in support and would like to thank the chair for hearing this measure. Thank you.
Thank you very much. Board of Nursing in support. Good morning.
Good morning, Chair, Vice Chair, members of the committee, Chelsea Fukunaga for the Board of Nursing. The board will stand on its written testimony in support of this bill. Thank you.
Thank you very much. That's all the testimony we received on this measure. Is there anyone else who would like to testify? Members, questions? Okay, we'll move to the next measure on the agenda, SB 1323, relating to Professional and Vocational Licensing Act. This is basically the same bill, but it's the admin version. DCCA in support.
Good morning, Chair. Again, Alani Kiyoki with the Professional and Vocational Licensing Division. Thank you for hearing this administration bill. The division will stand on its written testimony in support. Thank you.
Thank you very much. Board of Nursing in support.
Good morning, Chair. The board will stand on its written testimony in support. Thank you.
Thank you very much. That's all the testimony we've received. Is there anyone else who would like to testify? Okay, members, questions? Okay, seeing none, let's move into decision-making on these two measures. The recommendation for the first measure, SB 438, is to pass unamended. Members, any discussion? Okay, seeing none, Vice Chair, SB 438 passing unamended. Chair votes aye.
Thank you. Vice Chair votes aye. Senator McKelvey?
Yes.
Senator Richards?
Aye.
Senator Awa?
Aye.
Measure is adopted.
Thank you very much. And as I mentioned before, the second measure is essentially the identical bill. It's just the administrative version. We like the Senate bill better. We're going to defer this measure and we will adjourn for 1 minute to begin our 9:35 a.m. hearing. Adjourn. Good morning and welcome back to this Wednesday, February 22nd, 9:35 a.m. decision-making agenda for this Hawaii State Senate Committee on Commerce and Consumer Protection. We're here to vote on a number of bills which have been heard in a prior committee. We've also received written remarks on these measures and are prepared to make recommendations. The first measure is SB 442, Senate Draft 1 relating to health. This measure authorizes advanced practice registered nurses, in addition to physicians, to practice medical aid in dying in accordance with their scope of practice and prescribing authority. It also authorizes psychiatric mental health nurse practitioners, in addition to psychiatrists, psychologists, and clinical social workers, to provide counseling to a qualified patient. It reduces the mandatory waiting period between oral requests from 20 days to 5 days. It also waives the mandatory waiting period for those terminally ill individuals not expected to survive the mandatory waiting period under certain conditions. There is also a effective date on this measure. Members, the recommendation is to pass this measure out unamended. Any discussion? Seeing none, Vice Chair passing unamended. Chair votes aye.
Thank you. Vice Chair votes aye. Senator McKelvey?
Yes.
Senator Richards?
Aye.
Senator Awa?
No.
Okay, measure is adopted.
Thank you very much. Next measure is SB 64, Senate Draft 1, relating to Medicare supplement insurance. This measure requires insurers of Medigap insurance in the state to accept an eligible individual's application for coverage at any time throughout the year and prohibits insurers from denying the applicant a Medigap policy or certificate or making any premium rate distinctions due to various reasons, including health status. It also requires the insurance commissioner to amend or adopt rules accordingly and as a effective date. The recommendation here is to defer decision-making on this measure to March 2nd at 9:35 a.m. in this room. The next measure is SB 162, Senate Draft 1, relating to dentistry licenses. This measure allows the Board of Dentistry to issue, without examination, a community service license to practice dental hygiene in the employment of a community health center, and allows eligible candidates to submit as documentation and credentials diplomas and certificates of graduation from a dental hygiene college or dental college that has a reciprocal agreement with the American Dental Association Commission on Dental Accreditation, recognized and approved by the board. I'd like to note the effective date on this measure, and the recommendation is as follows. We will adopt the Board of Dentistry's recommended amendments. Members, any discussion? Okay, seeing none, Vice Chair, SB 162 SD1 passing with amendments. Chair votes aye.
Thank you. Vice Chair votes aye. Senator McKelvey?
Yes.
Senator Richards?
Aye.
Senator Awa?
Aye.
Measure is adopted.
Thank you very much. Next measure on the agenda is SB 317 SD1 relating to the Audiology and Speech Language Pathology Interstate Compact. This measure establishes provisions relating to the Audiology and Speech Language Pathology Interstate Compact to facilitate interstate practice of audiology and speech language pathology. It also requires the Department of Commerce and Consumer Affairs to adopt rules to implement and administer the compact. As referenced in the testimony, there are a number of issues with this compact that I believe still need to be sorted out to provide some certainty to the healthcare community. So the recommendation on this measure is to defer. The next measure is SB 473 SD1 relating to the practice of pharmacy. This measure exempts drug manufacturers, wholesale prescription drug distributors, and third-party logistics providers of home dialysis drugs, supplies, and devices from the license, registration, and permit requirements for pharmacies, provided that certain conditions are met. There's also a effective date on this measure. After reviewing the testimony, the recommendation is to pass this measure out unamended. Members, any discussion?
Chair, I appreciate moving forward for conversation, but I still have some concerns. I'll just go with reservation for now.
Thank you.
Chair, same as Senator McKelvey with reservations.
Thank you. Any discussion? Any other discussion? Okay, seeing none, Vice Chair, passing unamended.
Okay.
Chair votes aye.
Thank you. Vice Chair votes aye. Senator McKelvey?
WR, please.
Okay, Senator Richards?
With reservations.
Okay, Senator Awa?
Aye.
Thank you. Measure is adopted.
Thank you very much. Next measure on the agenda is SB 599 SD1 relating to health. This measure allows certain physician assistants to sign orders for respiratory therapy and plans of care. It also expands the class of healthcare providers under whom respiratory therapists may practice respiratory care to include physician assistants and advanced practice registered nurses. Noting the effective date and reviewing the testimony, the recommendation is to pass this measure unamended. Any discussion? Okay, seeing none, Vice Chair, SB 599 SD1, passing unamended, Chair votes aye.
Thank you. Vice Chair votes aye. Senator McKelvey?
Yes.
I'm sorry?
Yes.
Oh, okay. Senator Richards?
Aye.
Senator Awa?
Aye.
Thank you. Measure is adopted.
Thank you very much. The next measure on the agenda is SB 602 relating to health. This measure establishes permitting and education requirements for pharmacists ordering or collecting specimens for certain diagnostic tests or tests waived pursuant to the Clinical Laboratory Improvement Amendments of 1988, CLIA. It also expands the definition of practice of pharmacy to include the ordering of certain tests and collecting specimens for certain diagnostic or CLIA waived tests. There's also an effective date. The recommendation is to pass this measure out with technical amendments. Members, any discussion? Okay, seeing none, Vice Chair passing with amendments. Chair votes aye.
Thank you. Vice Chair votes aye. Senator McKelvey.
Yes. Yes.
Okay, sorry.
Aye.
Senator Richards.
Aye.
Senator Owen.
Aye.
Thank you. Measure is adopted.
Thank you very much. The next measure is SB 608 SD1. This measure requires pharmacies to provide accessible prescription drug label information to individuals who have difficulty seeing or reading standard printed prescription drug container labels, and inform the public that prescription drug label information is available in alternate accessible formats for individuals who have difficulty seeing or reading prescription drug container labels. It also requires the Board of Pharmacy to adopt certain rules by December 31st, 2023. There's also a effective date on the measure. The recommendation is to pass unamended. Members, any discussion? Okay, Vice Chair, SB 608 SD1 passing unamended. Chair votes aye.
Thank you. Vice Chair votes aye. Senator McKelvey.
Yes.
Senator Richards.
Aye.
Senator Owen.
Aye.
Measure is adopted.
Thank you very much. Okay. The next measure is SB 1016 SD1 relating to public-private partnerships for delivery of healthcare services. According to this measure, beginning January 1, 2024, requires the Chief Executive Officer of HHSC or designee to provide written comments to the governor before the state enters into any new agreement with a private entity, or modifies or terminates any existing agreement to transfer the right and responsibility to manage, operate, and otherwise provide healthcare services at one or more facilities of the Maui Regional System. It also expands the definition of private entity to include business organizations that are authorized to transact business in the state, including nonprofit management entities that have a certificate of need or license to operate one or more community hospitals or hospitals serving a rural population licensed under the laws of any state. There's also a effective date on this measure. The recommendation is to pass unamended. Members, any discussion? Okay, seeing none, Vice Chair, SB 1016 SD1 passing unamended. Chair votes aye.
Vice Chair votes aye. Senator McKelvey.
Yes.
Senator Richards.
Aye.
Senator Owen.
Aye.
Measure is adopted.
Thank you very much. The next measure is SB 1038 SD1 relating to telehealth. This measure clarifies reimbursement for services provided through telehealth via an interactive telecommunications system. It also defines interactive telecommunication system. And just to note again, there is a effective date on this measure. I'd like to thank the parties involved for working together on this one. We almost got there last year, but there's been a lot more robust discussion. So I appreciate the compromise language that has been submitted by multiple parties that encompass the Hawai'i and also HMSA. So the recommendation is to adopt that compromise language proposed by the Hawai'i that is specifically articulated in the record in HMSA's testimony. Members, any discussion? Okay, seeing none, Vice Chair, SB 1038 SD1 passing with amendments. Chair votes aye.
Thank you. Vice Chair votes aye. Senator McKelvey.
Yes.
Senator Richards.
Aye.
Senator Owen.
Aye.
Measure is adopted.
Thank you very much. The next measure is SB 1104 SD1. I just received a note from staff that I did not read yet, so we're going to move this measure to the end of the agenda so that I can review. SB 1340 SD1 relating to the practice of behavior analysis. This measure expands the exemption from the behavior analyst licensing requirements for certain teachers working in collaboration with a licensed behavior analyst or licensed psychologist. The recommendation on this measure is to defect the effective date of this measure to July 1, 2050, and also adopt some technical, non-substantive amendments. Members, any discussion? Okay, seeing none, passing with amendments. Chair votes aye.
Thank you. Vice Chair votes aye. Senator McKelvey.
Yes.
Senator Richards.
Aye.
Senator Awa.
Aye.
Measure is adopted.
Thank you very much. The next measure is SB 1370 SD1 relating to licenses to solemnize marriages. This measure establishes a standard license to solemnize marriages valid for 1 year from the date of issuance. It also establishes a short-term license to solemnize marriages valid for 60 days from the date of issuance, and establishes a fee of $100 per year for the issuance of a standard license and a fee of $25 per 60-day period for a short-term license. The recommendation on this measure is to pass unamended. Members, any discussion? Okay, seeing none, Vice Chair, passing unamended. Chair votes aye.
Thank you. Vice Chair votes aye. Senator McKelvey.
Yes.
Senator Richards.
Aye.
Senator Awa.
Aye.
Measure is adopted.
Okay, we'll take a short recess to confer before decision making on the last measure on the agenda. Recess. Okay, thank you. We're back on this 9:35 a.m. Wednesday, February 22nd agenda to consider SB 1104 SD1 relating to cannabis for medical use. This is amends the definition of cannabis to include propagules, cuttings, and seeds. After reviewing the testimony, we are going to defer decision making on this measure 1 day to tomorrow, February 23rd at 9:35 a.m. in this room. And on that note, we are adjourned. Thank you.